And as you can see, this is a well-balanced review committee. Okay, this is the posters and abstract awarded. The first place is abstract 16, which is on the this gallery if you want to read the details. And number 2, it's Julian Moore from the Department of Dermatology, Mount Sinai School of Medicine. And now I want to go back to the posters. I want to have a first place, Fei Ye, who is come from Pathology Department, come to the podium. The prize was given by the Dr. Hua Qin Wei, and okay, second awardee is Julian Moore. Okay, the presentation is the first awardee, Dr. Fei Ye.
The topic today is molecular mechanisms of anti-prostate cancer activities of scutellarian baculensis. Introduction. Prostate cancer is most frequently diagnosed malignancy in males. Recent surveys demonstrate about 40% of prostate cancer patients sees complementary and alternative medicine modalities for therapy, and finally induced cell growth inhibited. So that's it. Thank you for your patience.
Thank you very much, and we concluded this scientific session.
Good afternoon. Let's start the afternoon section. Welcome to New York Hospital, Queens, and welcome to ACAP annual meeting. I'm Dr. Huang. I'm the director of Inpatient Geriatric Service. Today, we will have two distinguished physicians and experts in hepatitis to give us updates in hepatitis B. Dr. Professor Tobia from New York University School of Medicine and Dr. O'Brien from University of Miami School of Medicine. Now first, Dr. Bin Lu, who is the former ACAP chairman, will give us an introduction.
Thank you, Dr. Huang, and welcome everyone. As we all know, hepatitis B is a very prevalent disease, and it affects, used to be said, 200 million chronic carriers worldwide. Now the more recent estimation is 350 million chronic carriers worldwide. I have the honor through the generous support of Gilead Sciences, of introducing two of distinguished hepatologists today to our audience. Our first speaker will be Dr. and Professor Christopher O'Brien, who is currently Associate Professor of Clinical Medicine in the Hepatology Division at the University of Miami. Our second speaker will be Dr. Tobias, who is familiar to many of the physicians here. He's from NYU, and Dr. Tobias looks like a New York native. He completed his undergraduate study at the Columbia University and went to Washington University for his MD, and he also completed his PhD study in University of London, studying under a famous professor focusing on liver disease. And Dr. Tobias currently is the clinical professor of medicine and medical director of organ transplantation service at NYU, where he is senior consultant for liver transplantation. Let's welcome our first speaker, Dr. O'Brien.
One of the things I found interesting is that the new epidemiology says that 1 person out of every 3 in the world has had evidence of a past or present hepatitis B infection. 6 billion people in the world, 2 billion have come in contact with hepatitis B. That's a remarkable prevalence. Migration patterns from Europe, Asia, Africa, and South Americans in particular coming up through Miami. So when you talk to people, everybody says there's a lot of hepatitis C out there. They see a lot of hepatitis C. But what's occurring is because they're now screening the blood so well for hepatitis C, the rate of new infections with hepatitis B is now 4 times that of hepatitis C. I wanted Dr. Tobias to have plenty of time to speak.
In the Asian American community in New York, we're very fortunate to get a rather large grant from the City Council, and we're going to be surveying about over 5,000 patients. And as I told Dr. Liu before, so far we're up to about 1,300 patients that we've surveyed this year. And the survey centers have been in Sunset Park, Chinatown, Manhattan, and in Flushing. And we're finding an amazing, so far the data shows 24% incidence of hepatitis B positivity in the population that has shown up for the survey testing. Hepatitis B is a very special risk in the Asian community because of the vertical transmission and the perinatal transmission. You have the chronic immune tolerant phase of disease, and so many of these patients are walking around with normal ALT levels, but significant DNA levels. Fall into undetectable levels, although the patient is still infected with the hepatitis B virus in their liver. And once you've seen one of these like young lymphoma patients, Hodgkin's patients, that winds up getting cured from their Hodgkin's and dying of fulminant hepatitis B for absolutely no reason at all, it's really a heartbreaking thing. So I'd like to leave you with that thought. Thanks.
For question and answer sessions, we would like to invite both doctors to sit in the front. First, hands up, Dr. Henry Chen, and then Dr. Jianjun Li.
You know, hepatitis B is becoming increasingly a problem of the primary care doctor, and I think that most of the primary care doctors in this community are sort of up on it, so I think that they should take the responsibility.
Hepatitis C, antibody, total IgG, all of that. So when we hit the surface of antigen again, it's still positive. So I don't know how to interpret this patient. Is it carrier or is it?
In some parts of China, you can have a patient with an abnormal liver function test profile. You test for everything. Everything is negative.
I don't think every patient who goes for surgery has to be screened, or general anesthesia has to be screened for hepatitis.
Those patients should be followed followed by the general practice China's caution followed by
There is no standard for screening, so most of us in the hepatology community sort of adjust our screening interval, at least I do, according to the severity of what instance I expect to pick up.
This is going to have to be done by general physicians. I mean, there's just too many people. If you're going to have to wait to refer every hepatitis B patient to a hepatologist.
Dr. Ming Zhu. Yeah.
One question. I have two patients recently found out they both have a hepatitis B surface antigen and antibody positive. Is it possible like that?
As surface antigen, very important concept. They have surface antigen and surface antibody. Forget the surface antibody. You can just treat them as any patient who didn't have it.
At which point did we now decide that we would say we're screening all of them and we will start to treat all those carriers?
It's sort of like the Framingham study, looking at high blood pressure, high cholesterol. Takes many years. Not everybody develops end-stage atherosclerotic cardiovascular disease, but it's a risk factor, and if you don't treat it in 30, 40 years, the person's at risk of having a heart attack, a CVA, or some other issue.
I think the numbers of people who develop consequences from this is probably less than 50%, but is really significant, particularly in the Asian male population.
Again, we really appreciate the two experts giving this such a wonderful up-to-date on hepatitis B treatment in the assessment. A big round of applause. And also, we like to thank again our host, New York Hospital Queens and Gilead Sciences for sponsoring this symposium. Thank you.
On behalf of ACAP, I'm granting Dr. Tobias and Dr. O'Brien certificate of appreciation for their support, ACAP, and their commitment to medical education. Thank you very much.
We will start afternoon section, the advancing medicine. Dr. Wei will be the moderator. And so Dr. Wei.
Hi, good afternoon. Welcome to ACAP 10th convention. And I think we already have an excellent program in anesthesiology and dermatopathology. This afternoon, I think you'll even enjoy these plenary sessions. The first, I want to introduce Michael Grady, MD, Vice President of Medical Staff Relation, New York Hospital of Queens, Flushing. At this moment, I also want to thank NYHQ give us generous support for this auditorium and refreshment and also staff support. Now I'm inviting Dr. Grady to give a remarkable speech.
Good afternoon. My name is Dr. Michael Grady, and I'm Vice President for Medical Staff Relations here at New York Queens. How's the day going? Everybody having a good time today?
Very nice.
Good. I went to the internet, and I basically looked up what a famous Chinese philosopher said about character. So I learned this morning, and I will read it to you. Character is to be able to practice 5 things everywhere under heaven constitutes perfect virtue: gravity, generosity of soul, sincerity, earnestness, and kindness. To me, my colleagues and this organization, that's what you represent. You are physicians, you are very generous, you do good things not only for patients, but you do good things for the community. What I'm overwhelmingly impressed with my colleagues who belong to ACAP is that they care so much about the community. They're always looking for ways to better the community, make the hospital better for the community. We cannot address issues and improve things without collaboration with our distinguished physicians from the Chinese community. And they have been very helpful to me, and I thank them very, very much.
Also here on behalf of ACAP, I want granting Dr. Grady the certificate of appreciation. Express our grateful appreciation to the hospital for their dedicated and to high quality and education, and also their continued support to ACAP. Thank you very much. Now we are going to start this afternoon's plenary session. The first speaker is Dr. Jianjun Li. I think we just finished some hepatitis information, and we wanted to hear some expert from our own Chinese community. And what's his experience dealing with hepatitis? What's his tip to treat hepatitis patient? Hopefully we can learn something from him.
So today my topic is update some office management of the common liver disease and focusing the selection and the interruption of the liver function test. So during this talk, I would like to outline the approach to the selection and the interpretation of the liver function test and define the pattern of the abnormality of the character of the virus liver disease, and lastly, approach those liver disease and in the office pattern. If patients show you which classification, you know what disease you are looking for. So this basically is some very mild liver disease and some moderate liver disease, some very acute liver disease, high liver enzyme, and some just patient presented with jaundice. So basically there's three most common classification. The first one is a typical chronic hepatitis B, and the second one is a e-antigen chronic hepatitis B, and third one is what we call carrier status. So this slides will show you the most common see the congenital liver disease, probably one of the see in Chinese population too. We just didn't aware those disease existent.
Anybody have questions? But we limited 3 questions. Whoever get first is first. Anybody have questions? Okay, number 1.
Use combination or you use the real person, then followed by
the treatment difference depend on the genotype. If genotype 1 is a little bit high resistant to therapy, we treat 1 year. If genotype 2 and genotype 3, usually we treat 6 months. There's 2 disease for the fat related with the fat liver disease. One is just a simple fat liver disease. 75% of those patients, if you do biopsy, there's no significant damage except just a microsteatosis. And those patients, usually you probably don't need the treatment at all, and you just give the assurance to the patient so that you are probably benign process and will never develop any fibrosis.
Thank you very much, Dr. Li.
Oh, thank you. Thank you.
Certificate of appreciation for his commitment to high quality medical education. Okay. Our next speaker, wow, Lisa, you changed your topic. Okay, is Dr. Lisa Ying.
Basically, we're talking about women's hormone therapies. And we know that we can use these things to treat menorrhagia, dysmenorrhea, endometriosis. So I want to go over that a little bit too. Short little 1 slide on treatment for Urge syndrome that's kind of new. All right, but we're going to be focusing on contraception as I promised. This is not contraception. I had one patient that took all the pills and put them in a jar and then just took them out one at a time. And they didn't realize they had to follow the pack. There are more than 18 million users in the United States. 1/3 of the reproductive population basically is on birth control pills of some sort. Some people think of Plan B only. Some people are just taking emergency contraception as a method of contraception. But usually as women get to 40, 35, 40, and they're definitely positively sure they don't want another child, they start to look at more permanent methods. That's basically it for menorrhagia. We spoke about most of the modalities for contraception.
Primary care setting, if a young female walk in and asking for contraceptive,
Dr. Zhu wants to know, in a primary care setting, basically, how do I get a patient started? Do I do any preliminary studies? I do the normal history and physical. I make sure that the uterus isn't large and myomatous. I look at the age of the patient. I look at her parity. Has she had any children? And if she has had or none, when is her goal for the next pregnancy?
Our third speaker is Dr. Hilary Boardman. Today, she's going to speak on updates on non-melanoma skin cancer.
So today we're going to talk about skin cancers that are not melanomas. Basal cells are by far the most common skin cancers that we see. They account for about 75% of all skin cancers, and the incidence has been increasing extremely rapidly over the last 30 years, and that's been blamed on the decrease in the ozone layer or holes in the ozone layer, but it's probably due to people having more of an outdoor lifestyle and people enjoying the kind of things that bring them into the contact with the sun more frequently. Also, with the focus on looking your best and looking skinny and all the things that the magazines are teaching us you need to do, many people feel as if having a tan is a very important thing for their appearance. So we see melanomas more in yuppies who go out into the sun. You know, every couple of months they go down to, I don't know, the Bahamas or something and get fried. They're the people who get melanomas. Your fishermen and your outdoor workers who are exposed to sun all the time. You didn't even appreciate this lesion down here, but he smeared the imiquimod all over that side of his face, and you light up lesions that you don't appreciate clinically. Whenever you treat with either the imiquimod or the 5-FU, that's why the patient looks so much worse in the interim before they look better. Here he is post-treatment at week 14 with absolutely nothing there. Thank you.
It's not adequate. What is the standard of care so far?
Well, if you're talking about a nodular basal cell, so that you absolutely know both visually and pathologically where the edge of the lesion is.
What is the PSF we recommend in order to prevent squamous cell carcinoma?
I didn't hear the.
What is the SPF?
That is to say, 8 is as good as 4, but once you get to 15, it starts to level out.
So any other questions? If not, I have 2 questions.
Okay.
The first question is that, as you mentioned, in immunocompromised patient, like renal transplant, the ratio of SCC versus BCC is much higher than normal population. What do you think that in experimental oncology, UVB is the predominant factor inducing skin cancer, and in animal model only squamous cell carcinoma, no basal cell carcinoma? So what's your explanation for this reverse phenomenon?
So it must be that the body, for some reason, is better able to detect it and stop it compared to that of a squamous cell carcinoma. But nobody, to my knowledge, has speculated as to specifically why that would be.
Thank you very much, and that's a certificate of
Oh, thank you very much.
appreciation. Thank you for Now I'm going to pass my torch to Dr. Henry Chen. He will be a moderator for next session.
We'll continue the scientific presentation in this afternoon section, and it's my pleasure to introduce Dr. Asa.
Thank you. So what I'm going to talk about today is really try and frame the problem of how stroke affects our communities, and then what we can do about it. A larger and larger group of patients, especially younger patients, have hemorrhagic strokes. Primarily, this is due to, if it's going to be subarachnoid, obviously due to aneurysms, but intracerebral hemorrhages is due to hypertension. So acute stroke treatment, just quickly. Obviously, the name of the game is thrombolytics, right? If you get to the hospital in time, if you get to the hospital in 3 hours, we know we can give you intravenous TPA. If you get intravenous TPA, you have a significantly improved chance of recovering and having minimal or no disability. It is our training as a physician when I was growing up that the first thing you want to do for hypercholesterolemia is what? Diet control, right? You want to use diet to control their hypercholesterolemia. And you understand that how damaging this disease is, because all of these cells enter the endothelium, go through it, and cause damage.
What's the role of external cranial stenting?
But there's no proven trial at this point showing that intracranial stenting works for everybody. You have to be very selective in your cases.
Concerns we need to address compared with the general population.
To understand, first of all, what the mechanism of stroke is in those patients. Thank you.
Now we're going to move on to the second speaker. Is from Citibank, and Mr. Michael McLafferty, and he's a CPA with 20 years experience in healthcare finance, and he's going to give us a talk from Citibank.
All right, what we're going to spend a few minutes, we're going to walk you through 3 different areas of information. We're going to give you a little bit of information on some Medicare changes for the current calendar year, 2005. My assistant, Maureen Doherty, is going to come up and give you some brief overview of some coding and documentation changes. And then I'm going to get back and give you just some highlights of the new HIPAA security standards that just went into effect. Well, you see MMA, that's the new Medicare Modernization Act that went into effect. One of the changes that affects all physicians here, and one thing that we see in our practice, a lot of physicians right now are getting audited, especially for coding and documentation issues. The second bullet, a lot of practices are purchasing imaging equipment, and they're using it as another line of income, ancillary type income, over a period of time. The amount of Medicare reimbursement they will get will be higher than their peers that have not either gone into this program or met the minimum qualifications. Make whatever changes you have to make and then resubmit. Don't just keep resubmitting the same claim over and over. Okay, I'm going to let Maureen come up and just give you a couple highlights on the coding side.
The first slide I want to go over, which is probably the most important of my slides, is how to increase revenue at your practice site. The first bullet talks about insurance contract reimbursement negotiation. And we find that practices open, they get credentialed with the insurance companies, they get their fee schedule, and that's where it stays. And the only thing that happens going forward is they re-credential every 2 years. Every year, you get new diagnosis and new CPT codes that are added. There's some that are deleted, there's some that are changed. This year, in October, new diagnosis codes came out, and then again in April.
There have been a couple things in the media recently about privacy issues.
The patient may sue, but that situation is actually protected. You're allowed to have a sign-in sheet. You don't ask for the patient's diagnosis.
Right.
But that actually is considered a passive release of information.
The comment was that you can have a sign-in sheet. If the patient sues, you're protected under HIPAA, but what we're finding out is that most of the states in the country, especially in the Northeast, the confidentiality laws are stricter than HIPAA, and they're actually being accepted in state court.
We have a partnership with Citibank, and also Citibank sponsor for this talk, and then I would like to introduce Citibank's Vice President, Linda Maxwell, to give us a brief talk.
Hello, my name is Linda Maxwell. I'm with Citibank, and we want to thank ACAP and the organization in CASA for inviting us to be with you here today. We're very proud of the fact that we recently signed an agreement with ACAP that entitles its members to special benefits with us, and you'll be hearing more about that. We also feel that we have an important role to serve as we work with you to bring professionals like Mike McLafferty and Maureen Doherty to you.
Now we move on to the last talk. It's from ASUS sponsors, Mr. Chris Madura. He's a pension specialist. He's going to represent Heritage Group to give us a talk for how to do a financial planning. He's Mr. Madura.
Thank you all for being here today. I'd like to introduce myself. My name is Chris Mulady from the Heritage Pension Services. and I have partnered up with AXA advisors, more specifically Jason Yee and Martin Zhao, on planning and designing retirement plans for many practices such as yourselves. It offers retirement benefits, disability benefits, and/or life insurance. It has to meet the specific requirements set forth by the IRS, and it offers tax-favored deductions along with tax-deferred growth.
Adiós, amor mío, no me llores, volveré antes que de los sauces caigan las hojas.
Hello, hello everybody. Ladies and gentlemen, doctors, noble guests, welcome to our 10th anniversary of the gala for the ACAP. I am Dr. Ming Ju, and also I'm the treasurer of ACAP. Every year I've been standing here to serve all of you. I don't think I did a good job, but they said, Ming, you have to do it. I said, all right, that's my responsibility. I'll do it. I'll do my best. Also tonight, I'm very lucky to have a doctor who together with me, and both of us will have the privilege to serve all of you. And I'm sure, and I'm hoping you will have a pleasant evening. But I'm sure you will have that.
各位嘉宾、新老朋友，欢迎你们的到来。我是胡小溪医生，也是医师会的会员。一年一度，大家在此相见，一点一点的从无到有，从小到大，医师会风风雨雨，已经进入了第10个春秋。在此，我欢迎大家到会，让我们有一个愉快的夜晚。 来庆祝我们10周年，而且也祝各位心想事成。
10 years is a long time, but the good thing is things change for good. I remember in 1995 when we just first started, and most of the member of then we called the AACP at that time. Or the resident physicians, or some of us even preparing to take the exam of the ECFMG. Only a few of us are the attending physician. Now, 10 years, we go all the way down the way. Now, look at us, and most of now is the attending physician. And a very good portion of us are private practitioner and practicing on everywhere and different level. And today we all give up a Sunday and we come here and we spend the whole day for the convention. We all try to learn more so that we can serve our patient better and also make our professional life more satisfying. And also, that's only the first part. And second part, like I always tell my patient, we have to learn when to be relaxed. And tonight, I guarantee you, all of you will have a relaxed and joyful time as well. First, let me invite our ACAP president, Dr. Hua Changwei, to give our president's speech. Let's welcome Dr. Wei.
Ladies and gentlemen, distinguished guests. First, let's wish the Association of Chinese American Physicians a very happy birthday on his 10th anniversary. Happy birthday to ACAP. It is a great honor for me
as the president of ACAP to deliver this special speech on many accomplishments of our organization during the past decades. I hope summary of this history will reignite your memories of your past undertaking and stimulate new visions of future of ACAP. 10 years, a transcendent moment in the universe, but an auspicious period of a newly formed organization. The ACAP has traveled a long, sometimes difficult journey to today's success. When I look at old photos of ACAP's previous events, many exciting moments and familiar faces has been refreshed in my memory. Today, many of our members have become very famous doctors with huge practice in Chinese community. Others have become internationally known physician scientists in academic centers in the United States. As we are all aware, the ACAP has survived many challenging moments, including the crisis we faced in 2002. At that time, the fate and the survival of organization was put into question. Thanks to Dr. Lu and our dedicated members, I also want to express my sadness for those we lost during the great hardship of the ACAP and extended to them my invitation to rejoin ACAP. Today, ACAP is stronger than ever with hundreds of members in almost all specialties. Let's work together to build even stronger organization in support of scientific research, practice medicine, and medical education. Thank you very much.
Thanks, Dr. Wei. Next will be introduction of our noble guests.
下面是嘉宾介绍。
First is the Ambassador Liu Biwei and his associate from Consulate General of New York, the People's Republic of China.
刘必伟大使及夫人，还有随同的官员。
谢谢。Next is Jimmy Meng of the Congressman of New York. Is Jimmy here yet? Probably still busy.
张六 New York City Councilman's Representative Miss Ellen Young.
John Liu always coming to support our convention 3 years in a row, and thanks again. And also we have the fraternal organizations. And first is the Dr. De Wei Guang from CAMS. Dr. Guang.
Dr. Mingde Zhang from American Cancer Society.
Yusen Wu from SAPA.
Dr. Dinglen Pang from TCMA.
黄定仁医生. No, he's here. Here you go. Hi. Next one is Tian Yongjiang from Sinovision. Thank you.
Dr. Da Xili from ACSB.
Jia Yixie from ACST. We thank you all for coming. I wish I could invite all the VIP guests to come up to give us a talk. Unfortunately, time's limited. I can only invite a few of you to give a speech. And first, let's welcome Ambassador Liu Biwei
敬请刘必伟大使为晚会敬词。
各位朋友，今天晚上非常高兴来，在这个应邀参加这个晚会。在我正式讲话之前呢，我刚才碰到一个朋友，我跟一个医生朋友说，我说要在纽约同一个地点、同一个时间，要见那么多的中国人，一点都不困难。但是要见那么多著名的医生，实在是不容易。所以我有这个荣幸，非常的高兴，非常的感谢。来之前，我询问了一下，是讲英文好呢，还是讲中文好？下面的领事告诉我，经询还是说中文吧，因为中文是我们的母语。第二个，我的英语也比较糟糕，请大家原谅。各位华人医师会的朋友们，各位来宾，大家晚上好。我非常高兴和我的夫人应邀出席今天晚上的10周年盛会。首先，请允许我代表总领事馆衷心的祝贺美国华人医师会第10次年会的胜利召开。我知道，贵会是由500多名执照医师组成的高水平的专业团体。自1995年成立以来，贵会始终关心国内的医疗体制改革和医疗水平的发展，希望大家团结合作，共同为促进中美两国人民的友谊贡献自己的力量。最后，祝在座的各位医师、各位朋友身体健康，家庭幸福，事业发达，万事顺意。谢谢大家。
感谢刘大使的致辞。
Next will be the representative of New York City Councilman Alan Young. Please welcome Alan Young.
为大家致辞。
各位亲爱的贵宾，刘必伟大使夫人、魏会长、杨会长，各位医师会员和家属亲友们，艾伦非常荣幸可以代表市议员刘纯义来到此地，在连续第4年向贵会道恭喜的时候，跟您故作今晚。那么特别给各位带来一个纽约市市议会的表扬状，专门是颁给我们美国华人医师会的。那么现在我就来介绍这个表扬状的内容。我也想请我们魏会长上来一起分享这个荣耀。这个表扬状呢，将会在纽约市的市议会里面留下一个永久的记录，也恭祝我们美国华人医师会会务蒸蒸日上，会员与日俱多。我相信明年的时候，刘议员一定可以亲自来跟各位共度一晚。谢谢各位，身体健康，万事如意。
谢谢，谢谢。As everybody will see, and ACAP now is getting busier and busier. We need a lot of volunteer members' contribution, and luckily we have more and more dedicated members contribute their priceless time and effort to the association. ACAP really appreciate it, and the following 3 members will be awarded for their Distinguished Members Award.
Dr. Lisa Ng, 吴医生。
Lisa, welcome. Great job. Dr. Abel is contribute to our symposium, and also she's in charge of the educational committee of ACAP. She did a great job in the past year. Dr. Zheng Bo Wang, he's the attending of the New York Hospital Kings, specialty in the geriatric medicine, and he did a great job to organizing all the symposium, and even today's convention, he did a great job for us. Next one is the Dr. David Zhang. Unfortunately, Dr. David Zhang rushing for another trip, so he just left earlier. Dr. Wei made sure we melt the plaque for Dr. Zhang. We'll do it. ACAP is not the only organization dedicated to our Chinese community. And also a lot of other organizations in society, they contribute to our society as well. 2 of them really did a great job last year. Our association really appreciate the effort, and will grant them the Distinguished Community Service Award.
American Cancer Society, Dr. 明德张，张明德医生。
Next one will be Visiting Nurse Service of New York. Welcome, welcome. Great job. Stella Wang. I remember her name. Wang. Oh, Kwang. Oh, very close. Now it's the photo time. All the ACAP board members, please come up to the stage. We take a quick photo. Thank you, everybody. And next, let's invite our New York Congressman Jimmy Mang to give us a talk. Let's welcome Mr. Mang.
孟广任议员，孟广任先生。
Thank you. I'm very honored to be here tonight. First, congratulations on the 10 years anniversary. For so many years, I'd like to commend the great effort of the president and the board of directors and all the members of the association for providing the quality health care to this community. And my name is Jimmy May. I'm the state assembly of Flushing district. I've been on the job for 6 months, and my job is very challengeable and I'm very busy. For 6 months, I already introduced a bill and sponsor over 48 bills, and I hope we can work together for the futures. And 各位尊敬的大使夫人，还有会长杨爱伦女士、杨博士，各位医生会员，非常荣幸来参加这个10周年的这个医生大会。在过去10多年以来这个协会提供了我们这个社区很多的医疗的这个 quality 的这种服务我非常荣幸能够来参加今天晚上的这个大会。然后呢，我是代表这一区的州里面的做立法的一个代表，希望以后能够多多跟我们会议里面的所有的会员多多来保持联络，希望提升我们华人在美国的地位，也希望我们这个社区更进一步的融合。谢谢大家。
谢谢孟管用先生的讲话。
The last section will be very short, and we thank our sponsors. Now, let me introduce the sponsors. When I read the name, please come up. We will grant you the certificate. The first one is Gillette,
Citibank,
AXA Advisors,
Medline.com,
WellCare Insurance,
Maimonides Medical Center,
3M Pharmaceuticals,
Roche Pharmaceuticals.
Could you please come up here? The name we just announced. We will grant you the certificate. Citibank, AXA, MDLand.com, WellCare Insurance. Oh, you're here. Good. Maimonides Medical Center. Dr. Lee, please come up here. 3M. Roche Pharmaceutical. Also, we thank the following sponsors: New York Hospital Queens,
Oxford,
Elim Consulting Group, Sharing Proud,
Novartis,
Sanofi Aventis,
MetLife Financial Service,
Visiting Nurse Service,
PRI,
BI Pharmaceutical. Thanks all. Now all the business done. Now let's start tonight's entertaining program. So just be relaxed, enjoy the food, enjoy the program. Thank you all. Now I'll pass to Christine. She will tell you what you're gonna see now.
Hi. Good evening, ladies and gentlemen. My name is Christine. It's my pleasure and honor to be here tonight to be part of the entertainment program. The first program I would like to present to you is the beautiful dancing princess. Would like to share Egyptian belly dancing with everyone. So please have a big round of applause to welcome the dancing princess. Another big round of applause to this beautiful dancing princess. Wonderful performance. There may be time since I'm far away. Never wonder where I am, 'cause I'm always by your side. 'Cause I'm your lady, and you are my man. Whenever you reach for me, I'm gonna do all that I can. We're heading for somewhere I've never been. Sometimes I'm frightened, but I'm ready to learn of the power of the sound of your heartbeat, made it clear suddenly. And the feeling that I can't hold on, it's light as a wave. 'Cause I'm your lady,难除了你我也未央，心里想的人不一样。
来，这也祝您吉祥如意，财源广进。眉眼过来，红红我逗我乐开怀。哎，下面我们这位先生又为你们唱歌了啊，请你们注意，来唱。
我左看右看，上看下
一起拍拍手好吗？
都不简单。我想了又想，我猜了又猜，女孩们的心事还真奇怪。
来，谢谢，谢谢你。
Antes que de los sauces caigan las hojas, piensa en mí, volveré por ti. Pobre infeliz, se paró tu reloj infantil, una tarde plomiza de abril, cuando se fue tu amante. Se marchitó en tu huerto hasta la última flor. No hay ni un sauce en la calle mayor para Penélope.
什么流浪远方。
Next, we have a small raffle donated by Elim Consulting Group. Jason, please come up. Jason is the president of the group. Jason, what are we going to have now?
We're going to draw 4 prizes.
4 prizes. What's the prize?
Spa treatment, facial treatment.
Facial and spa certificate, but it's only for women then. So every husband, you know, only you can bring in at home for your wife or your girlfriend. All right, now let's start it now. Number one. Number 1. Hurry up, Jason. Dr. Wen Jing Tao. That's a certificate for the spa when we're much more younger and more beautiful. Next one is Xiaoling Wang. Okay, next one. 2 more to go. 2 more. Whoa, this is Ming Ju. Okay, the last one is Dr. Yuxi Chen. 不去了，今天晚上。
舍